One of the hardest things when you are a new dentist is having the pressure to sell treatment plans, like especially if pushy is not your personality. I do think that some people are just naturally more pushy than others. I've been practicing for 15 years and this is definitely something that I've struggled with because I am not a pushy person because I hate that pressure. Now, over the past many years, I've had to re-examine my relationship with selling because while I don't really love it, my colleagues do it and that's how they get the sales and they get the treatment plans. I'm not the type of person who's all of a sudden going to become a sales machine. It's not in my DNA, but there's a lot that I learned about communication. So first of all, I used to be one of those people where I would give patients every single option. What I learned is that this confuses patients, and what I started doing instead is still listing all the different options, but being very clear about my recommendation for the patient. To me, there is a difference between being clear and educational and being pushy. And pushy is like trying to convince them of doing something regardless of whether it's in their best interest. Versus recommending is being really clear about what's going to be most beneficial for them. Pushy also comes in different forms where like you're trying to force the patient to do treatment that same day. Those are the things where I'm kind of like, I actually want patients to know what the recommended treatment is and get their ducks in a row. I don't want them to go home and be like, oh my God, what did I do?